Gail and Emily are with us live this evening from Halifax, Nova Scotia. Good evening, ladies.
Hello.
Hi.
Yeah, welcome. Now, before I start, I would like to provide you with some background on Emily and Gail, just so that you can get to know them a little bit better. So we have Gail Creelman, who is a native of Bayfield, New Brunswick, and was a nurse at the IWK Health Center Halifax starting in 1978. The IWK, for those of you who don't know, is a pediatric referral center for Nova Scotia, Prince Edward Island, and New Brunswick. And Gail received a diploma in nursing from Niagara College in St. Catharines, Ontario, a continuing care diploma from St. Francis Xavier University and Ganish, Nova Scotia, and completed the Canadian Association for Enterostomal Therapy Education program in 2003, which is now the NSWOC WOC Institute WOC program. And I thought it was really interesting that Gail was one of the first group of ET nurses or NSWOCs in Canada who received Canadian Nurses Association certification in 2009. So she had a long pediatric surgical and burn care career. And then she moved into the role of an enterostomal therapy, or now NSWOC nurse, at the IWK in 2001. And besides providing education and support for wound management and ostomy care, she coordinated a bowel management program. And then she added ambulatory burn care to her portfolio in 2011. And I know that Gail has been a major contributor to the WOC Institute as an academic advisor for continence care, but is now officially retired from both the hospital and from the WOC Institute. And I also know that she's a bit of an artist. And I don't know, Emily, if you could just kind of move your camera to show the lobster, and there's some artwork behind, both of which were done by Gail. So a very talented lady. And then we have Emily Woodgate, who is her daughter. She's a certified NSWOC at the IWK Health in Halifax, Nova Scotia, the same place that her mom worked. She graduated with a BSCN from Dalhousie University in 2010. And after spending several years on a busy surgical unit, she completed the wound ostomy and continence education program. In 2018, she accepted the position of nurse specialized in wound ostomy and continence at the IWK, working with patients in all three subspecialties, ranging in age, starting at newborn, or actually starting at premature babies, so right from birth. She's presented at local and national conferences, as has her mom, and is involved in several research projects. She was recently appointed by the NSWOC Board of Directors as the new lead for the pediatric community of practice. And congratulations, Emily. Well done.
Thank you.
Yeah, and she's a mother of 2 young children, and it sounds like her mom, Gail, is a top-notch caregiver of the children, but I'm sure it's not hard work by any stretch of the imagination. So I think it's time to get right into the interview, but I wanted to set that stage. And so, Gail, could you briefly describe what led you into the nursing profession, and were there any pivotal moments that supported your decision to become a registered nurse?
Thanks, Cathy. Actually, Cathy, you told my whole story, so I don't really have to say anything now. We'll start at the beginning. I was brought up in rural New Brunswick, and I mean very rural. Went to a one-room schoolhouse. Was the only one in my grade until grade 4. And back then, when you went to school and were thinking of careers, about the only careers for girls that came to mind at that time were nursing, teaching, or secretarial. Since I took academic instead of commercial back then, secretarial was out. My mother was a nurse. And as I was growing up, I got a lot of, I suppose you're going to be a nurse just like your mother. And I'll tell you, after you hear that a lot of times, you get to the point that there's one thing you're not going to be, it's a nurse. So I was aiming to be a teacher. That was my focus. Mom stopped working when she had her family. So it wasn't until I was in high school, I guess, that she took a refresher course and went back to work. And then I really started to pay attention. She loved working. She loved her co-workers. She was always talking about what they did, and within the community back then too, doctors were few and far between. A lot hasn't changed actually. And Mom was the go-to person. If somebody needed an injection, they would call Mom and see if they could come and she would give it. Or if somebody had a wound or needed something looked at, then it would be Mom they came to. Now, Mom never pushed me to go in nursing. That was never even mentioned. But as I watched her, I really began to think, yeah, this is what I want to do. Well, by the time I made up my mind I wanted to go into nursing, it was too late to apply. All the schools were full. Back then, the nursing schools filled up quickly. I really didn't want to go in New Brunswick because it was a 3-year course. Halifax was 2, and I was too late to get in. So, excuse me, I decided I would still stay in school because I worried that if I quit and got a job and got a little bit of money in my pocket, I wouldn't want to go to school. So a friend and I came to Ontario. We came to Brampton to Sheridan College and took a lab technician course. Her sister lived in Toronto, so we used to hitchhike, mind you, into Toronto on weekends. And I'd never been in the big city before. So we always joked that this was my, I learned a lot, but it wasn't necessarily from my course. It was my socialization 101. But while I was in Ontario, I had friends going to nursing school in Hamilton and in St. Catharines. So after going to visit them and see how excited they were about nursing, that confirmed that that was what I wanted to do. So I settled down and applied to Mac School in nursing. It was Mac School then, and then it changed to Niagara. And I was accepted, and I went to nursing school in Ontario because New Brunswick was still a 3-year program.
Excellent. And so before we move on to another question, I wanted to ask Emily, were you aware that your mother hitchhiked in Toronto?
Can I tell you an even worse story about this? Because all I can think of is there was a snowstorm here while she was, at the end of her career in nursing. She couldn't get her car out of the driveway. And my childhood house that she still lives on is at the bottom of this humongous hill. And that woman walked up to the top of the hill to the busy street and hitchhiked to go to work in a snowstorm, and got in a truck with a bunch of construction men who would take her to the IWK in the middle of a snowstorm. So hitchhiking, it doesn't surprise me that she hitchhiked in Toronto because that's what she does.
Yeah, it sounds like she has great passion and dedication to her patients and getting to her patients. So that's a great story, Emily. Thank you.
So far, she's survived.
Yeah. So based on your mother's background, when you told her you were going into nursing, Gail, what did she say?
What did I say?
No, what did your mother say?
Oh, my mother was very pleased. I think the bottom line, they were very pleased that I had actually decided what I wanted to do with my life. But mom was very excited, and we had some long discussions about it. Like I say, it wasn't until later years when Mom went back to work that she really showed her passion for it. So that really caught on. And I actually had the opportunity to work with my mother because in my summer in training, I went home to Sackville, New Brunswick and worked as an aide in the hospital there. And Mom was working there at the time. So that was quite exciting.
Wow. So we have 3 generations of nurses. That's pretty impressive. So you talked about being in St. Catharines and you went to nursing school in St. Catharines. So what happened after you graduated? Can you describe the early phase of your nursing career? Where did you work? How did things go? What was your experience?
I actually had an interview at Toronto Sick Kids. Got a job. I went for a tour, walked out and said, no, thank you. And then I applied at the IWK in Halifax. At that time, my father had just been diagnosed with cancer. So I wanted to come closer to home, and Halifax 3 hours from my home. So that was my incentive to come home. My first job was at the IWK. It was then just a children's hospital. And I worked on AENT floor, ears, eyes, nose, and throat floor. Back then, all the tonsils and adenoids were admitted overnight. So I had great experience given Demerol and atropine. I could do that in my sleep, drawing up Demerol and atropine, because we'd send as many 13, 15 kids to the OR every second day. Things have changed a lot since then. But I worked for 2 years, saved every cent I could, and then a friend and I went to Europe and spent every cent we could while we were there. So then when I came home, I was broke and I needed a job quick. So I got a job at the adult hospital here in Halifax on a medicine hematology floor. It was fun and it was quite an experience, but I wanted to go back to pediatrics. So after a year, I got a job back at the IWK on a surgery burn unit floor. And the surgery floor had more than 10 services and the burn unit. So it was very exciting. There was never a dull moment. There was always something new. There's no way you could ever know it all, but you learned a lot. After I had Emily, I went part-time. And then I decided I would do casual for Home Care Nova Scotia. So I did casual for them, and it was probably one of the smartest things I ever did, because it gave me a great perspective, because on the one hand, I was working acute care, and on the other hand, I was seeing the other side of the spectrum, trying to set up care in the home. So that was very exciting.
So it sounds, as soon as you graduated, you were attracted to pediatrics. What drives that attraction? Like, it sounds like you really had a passion for working with children. Yeah. Where does that come from?
I don't know. There's nothing special, but I always loved working with kids and playing with kids. And yeah, it was just fun. My brother had 4 kids before I had mine. So I had lots of fun times with my nieces and nephews. So I think that might have a lot to do with it.
Right. And so then you went into wound, ostomy, and continence nursing. What was the motivating factor that made you want to pursue education in the tri-specialty?
Well, after 20 years on the surgery floor, I was working with a lot of the patients that would be seen by the enterostomal therapy nurse. Wounds, ostomies, anal rectal malformations that had the bowel management problems. I especially enjoyed I guess that's the wrong word, had a passion for the kids who had incontinence issues, fecal incontinence issues, because it always seemed like everybody else was getting the attention and these kids just sort of suffered in silence. There was nothing special for them. You didn't see them on the telethon. And the families really struggled. So that sort of became a passion for me. One day when our ET was on the unit and we were working with an ostomy patient. She said, "You really like this stuff. Why don't you think about becoming an ET?" That was Joan Kennedy, for anybody that remembers Joan Kennedy. And the more she told me about it, the more interested I became in it. But my worry was I had never worked in neonatal. My nearest ventures in the neonatal unit were at Christmas time. They used to float us up there to feed babies in the back room. Babies in the back room were just babies that were gaining a little bit of weight before they went home. They were normal babies. So she said, "Oh, it's no problem." She said, they're all the same as the bigger kids, except everything is smaller. And she said, when you're doing ostomy changes and dressing changes, you have to adapt them to fit them. That's really cool. I like arts and crafts. I can do that. So she kept persuading me. So I decided to apply. And at the time that I applied, the school had decided that they would only accept applicants who had their degree. And I did not have a degree. I had lots of courses, but no degree. So I had to get some letters of recommendation. And one of them was from our chief of surgery at the time. And he just saw me in a halo of developing the bowel management program. So he wanted to make sure I got into the program and became an ET. He was going to groom me well for that. So that's basically it. When I took the course, it seemed like it took forever because back then there was no sending papers back and forth online. It was all snail mail. But yeah, I enjoyed the course and got through it and became an ET and developed a bowel management program.
Excellent. Did you bring any of your experience from taking the enterostomal therapy program at that time into the time and the phase that you were an academic advisor for the Continence program?
I became sort of the go-to person for anything about fecal incontinence, but yeah, I mean, you always take your learnings with you wherever you go.
Yeah, and I know you did quite a bit of work with conference presentations and continence workshops in the past, which really helped contribute to the knowledge base of many nurses that are out there. So as a pediatric wound ostomy and continence nurse, or nurse specialized in wound ostomy and continence, what was your biggest challenge? Tell us about that big challenge.
Oh, I had a couple of them. My biggest challenge was that, as I had said, I never worked in an ICU, and a lot of our patient population were there. They graduate to the surgery floor, but in NICU, I had no experience. I was terrified. I'm not afraid to say that. I mean, you go in and look at these little 1.5, 2 pounders and trying to put an ostomy pouch on them. So well, first off, Joan's office had been in the NICU unit. So I was kind of forced to get into NICU in the first place and get to know the staff, which was wonderful. And the staff were great. So we came to a very clear understanding that I didn't touch respirators other than to do skincare. I didn't fiddle around with tubes. I did the wound care, the ostomy care, anything along that line. And they helped by turning and looking after the baby. Because I was so afraid I was going to pull something out that, and it was a good partnership. And I mean, you can't know everything, and neonatal wasn't my forte. So I got more comfortable the longer I'd been there, but yeah, it was a bit challenging.
Right.
The other challenge was time, because Joan had been working 0.5. And after I graduated and started to bring on more patients, the workload increased. And one of the biggest increases was the bowel management program, because it took a lot of time. And so I advocated and I got the position up to a 0.8. And then along the way, the maternal, newborn, and women's health moved to the IWK. And so that became under my umbrella, the wound care part. And then they decided that a good area to have the ambulatory burn care would be to have me do that too, because I was there 5 days a week. So when the burns came in, I could do the dressings on the ambulatory burn care. So we very quickly then got it increased to full time. But bowel management is probably, I don't know if Emily agree with me or not, one of the bigger parts of the role. Besides the burns come and go, but bowel management is time consuming.
Wow. Well, it sounds like you have a few different legacies, but one of your biggest legacies is the fact that your own daughter, Emily, followed your footsteps into nursing. And beyond that, she continued to pursue wound, ostomy, and continence nursing to become a certified nurse specialized in wound, ostomy, and continence. When you look at her, what comes to mind?
I'm very proud of her. She's become a wonderful, wonderful person and a nurse. And it's been such an honor to work with her, because I had never in God's green earth thought she'd ever go into nursing.
Well, tell me about that. Why did you think that?
That makes two of us.
I said she kind of followed in my footsteps almost too closely, because when she finished high school, she had never given any indication, nor did I think she at that time ever thought about going in nursing. She went into forensic sciences, and she'll tell a different story, but I thought it was because Gil Grissom on CSI was quite an influence at the time on TV. But Christmas of her first year in university, she called me in her room and she said she had something she wanted to tell me. She wanted to know what I would think if she told me she was going in nursing. And I tell you, I was dumbstruck. I was just, nursing? You were going to nursing?
No, she said, oh, and walked out of the room, left, just like, oh, and walked out. That was it. That was the conversation.
Well, she totally caught me off guard, because you can tell the rest of that story, Emily, what I was thinking.
I had been dating a not so great guy. So she thought that I was either pregnant or getting married, or that I was dropping out of school altogether, because she knew that it wasn't going the way I thought it was going to. So that's what she was expecting, not that I was switching into nursing. But yeah, that was her response. Oh.
Like I say, I was dumbstruck, because that was the last thing ever on my mind. But anyway, after that, she asked me if I had to do all over again, would I go into nursing? And I said, oh my goodness, yes. I have had a wonderful job. I had a wonderful career. I would do it again in a flash.
Wow.
And just going back to her, like, it's been such a pleasure. I've had the opportunity to work with her, and I've had the opportunity to orientate her to the NSWOC program. I've had the opportunity to do presentations with her. I mean, what more could a mother ask for? And in recent days or weeks, one of the physicians at work said to her, he said, you know, every once in a while when you open your mouth, your mother comes out. And I don't know if he meant that as a compliment or not, but I took great pride in that statement.
Wow. And so when you hear that, Emily, and there's a saying, and it's children learn what they live. So what's your view on that statement in the context of your nursing career? Children learn what they live.
I think maybe I'm kind of the epitome of that. because I mean, I grew up surrounded by mom and her friends who were all nurses. So I loved the stories that they would tell. I loved their twisted sense of humor, because we all have that twisted sense of humor. And I just loved, I would get to go into the hospital with her when she went for meetings when I was young, and I'd get to get my orange pop and the coloring pages from the nursing desk and listen in on the grown-ups meetings. And as I got older, I would travel with mom for the conferences. I was old enough that during the day while she was at the conference, I would go off wherever we were, Ottawa, wherever we were, and do my own thing during the day. And then I'd be invited to the social events in the evening. So I'd mingle with everybody and get to meet everybody. So I just sort of became comfortable in healthcare, in the hospital. And when I decided to go into nursing, it was just like, it was meant to be. That was it.
Yeah. And did you share the same attraction initially to pediatrics that your mother did?
The IWK was like a second home to me. I was very comfortable there. I loved every setting that I was in during nursing school. But when I went to NICU, so this is where we differ, I went to NICU for a rotation and I thought, this is it. This is what I'm going to do. But there was a hiring freeze when I graduated. So I actually took, and I didn't realize that about you, Mom, that you did an orientation at Sick Kids and walked out, because I was in the middle of an orientation for adult orthopedics here in Halifax. And I got a call from the manager that they had just lifted the hiring freeze, and I was offered a position on the surgical unit at the IWK. And I probably burned all the bridges. I walked back to the table where I had just given all the pension forms, and I said, can you just pull mine out of the pile? I'm gonna go. And I walked out. Never looked back.
Wow, interesting. And so not only did you follow your mom's path and your grandmother's path into nursing, but you also followed your mother's specialization into wound, ostomy, and continence. When did it come to you that that is the specialization you wanted to go in?
Well, first of all, I never wanted to be a nurse, ever. Was not my intention. And when I was younger, I would call my mom the poop nurse, sometimes not in such a nice term. So I certainly was never planning on becoming a poop nurse myself. But like I said, I was taking forensic science. I wanted to be a forensic anthropologist. It was bones that led me to that, not Gil Grissom on CSI. But it just wasn't meeting my expectations. So, light bulb moment, I decided I was going to nursing, switched all my specialties. But I was working on the floor for about 7 years, 6 or 7 years. And I actually was having trouble getting pregnant for quite some time because of the shift work. And I thought, I need to do something that's going to get me out of night shift and into days. And I really love teaching. I would present a lot at local conferences for, whatever needed to be done at that time. I was a CPR instructor as well. I really like teaching. So I was trying to figure out what I could do that would involve teaching, but also keep some bedside nursing. I didn't want to, always be behind a computer. And it was like another light bulb moment where I was like, this is it. I'm supposed to do this. I'm going to take the course and go into NSWOC nursing. It was ET nursing then.
Yeah. And what could you describe some of the personal values that you have that you've carried into the specialization of wound, ostomy, and continence in pediatrics?
I think education, continuing education, and communication are just so important. Nobody knows everything. And if you have come close to knowing everything, which I see a couple names, I was looking at the participants, I see a couple names who are close to knowing everything, and they've been doing it for 40 years. So you just need to keep bettering yourself, taking every opportunity to learn. That's why I was really excited to take the pediatric program lead because it'll give me a chance to get out there and learn more. So it's just being involved, talking to people, networking, continuing your education are all so important.
Right. So it sounds like you kind of grew up in the field of pediatric wound ostomy, continence nursing, observing your mother. What do you think has changed since your mother worked in the field?
Everything and nothing at all. I mean, technology's changed, but it's the same struggles. I feel like it just cycles around. I will say there are now 2 of us working. We have, well, 1.8 of us, I guess, working in the NSWOC position at the IWK. I'm sure Mom will say that it took 2 of us to fill her shoes. In some ways that's true, but we have expanded a lot. We're doing a lot more proactive work in pressure injury, a lot more bowel management, and both the other NSWOC, Bridget Pino, and myself just graduated from the certificate program for RN prescribers at Dalhousie. It's a bit of a pilot project, but we are now authorized to prescribe within our scope. So we can, write orders, diagnostic tests, prescriptions for our patients, which is very exciting.
Oh, wow. Congratulations. Wow. That's going to make a significant impact within your wound ostomy continence practice.
It's really great for both efficiency on the patients and for our efficiency as well.
Yeah. And Gail, what changes have you seen, based on, I know you went back and filled a maternity leave and you have conversations with Emily. Is there anything that stands out to you that's really changed in the field since you were there?
The biggest thing is the prescribing. We tried to do that years ago, and that we could order certain things like bowel management drugs, and but it was a hard sell. So I'm so proud of them for doing that now, because it saves a lot of time, because you had to track down physicians to sign prescriptions for ostomies. Either that or you got them to sign a bunch of blank prescriptions and filled in what you wanted, which is ironic because they didn't know what they were, so why were they signing these? So that's a big step forward. Right. And just like Emily said, some things haven't changed, like the basic care has not changed.
Mm-hmm. And so thinking of your mom, Emily, what skills did you learn from her that have helped you kind of integrate into your role in wound ostomy and continence?
I would say communication is probably the biggest skill. And I say that because anybody can learn the hands-on things, I feel like. But I watched her be best friends with the cleaner and the ward aide, and, and it really struck a chord with me. And I think I told Mom when I started working at the IWK, it was a really good thing that she was well respected, or it would have been really hard for me, because everyone likes her that meets her. And it just gave me appreciation. I also started as a ward aide, which, by the way, having a mother who works there doesn't help. I applied 27 times before I got a job. I started as a ward aide, worked my way up through clerical, worked my way through nursing school. So I knew the jobs, but I mean, try doing our job without talking to the ward aide. You're going to learn really quickly that you're never going to have what you need. You need to be kind to everybody and network. We're not alone. And like I said, I was scrolling the attendees and I see so many people that I know on the list that I reach out to for help. So just learning that I'm not alone and I can ask people for help and communicate with everybody, be kind to everybody. That's really the skill that she passed down that's most helpful.
Excellent.
Don't cry, Mom.
Emily said I was going to cry during this, so there you go.
That's okay. Well, Emily, you yourself have 2 young children. As I mentioned earlier, your mother, it sounds, enjoys every minute of taking care of them and being with them. What's your hope for their future careers?
I just hope that they find something that they love, because I really do love my work. And I mean, I hope they make enough money to someday move out and support themselves, but we'll deal with that when the time comes. I just hope they're happy and that they feel fulfilled.
Yeah. And Gail and Emily, I mean, the bond that you have is so special. You can definitely tell that you were raised in an environment that was really supportive of the nursing profession, the role of nursing, and beyond that, the wound ostomy and continence specialization. What words of wisdom would you have for people who might be interested in becoming wound ostomy continence nurses, or just from your experience being one? Maybe we'll start with you, Gail, and then come to Emily.
Well, Emily already touched on some of this. You never have to work in isolation, because there's such a network of NSWOC nurses across Canada and beyond, that you only have to tap into their knowledge and skills, and everybody's so helpful, and somebody somewhere will know answers to things, and you don't need to recreate the wheel if somebody else has done that. My other advice is to become involved with your colleagues and fellow NSWOCs and share information. One of my first experiences was working on Body Talk, a teen magazine we developed many years ago. But in doing that, I got to meet several pediatric NSWOCs or ETs across Canada. And I'm still in touch with a lot of them. It's a bond that stays forever. And my first conference and presentation, if you get the opportunity, go to conferences. If you get the opportunity, present, because it gives you a chance to share and learn. And also another very important part is industry. Use industry to talk with them, involve them, because they are a backbone to some of our services, and they're all important. But just remember, nursing's ever changing. And if you don't change with it, you're going to get left behind. So continuing education is very important.
Yeah. And when you mentioned Body Talk, we still have copies of Body Talk that are requested by pediatric hospitals. We still have some that we ship a box every year, and the information was so well displayed and communicated in Body Talk that it still transcends over the last 19 years. So that was an outstanding project. And what about you, Emily? What are the words of wisdom that you would like to leave with the group?
Honestly, I think that's really it, is you're not alone. Other people have darn sure had your struggles and will learn from your successes. So reach out to people, go to conference, make your own mark on this. I like to say I was born into it. I learned it through when I came through the womb, but I also want to make my own mark. So be you, learn from other people, get involved in everything you can. There's so many supports out there. And I mean, shout out to industry for sure. That was a great one, Mom. I see Greg and Kevin and Shelly. Sorry if I missed anybody down lower. I haven't scrolled down, but I see our industry people are here watching tonight too. So I just, you're not alone. You need help, reach out, because someone's going to help you.
Right. And this was really interesting. I just love the dynamic between you two. It just radiates goodness and the passion for wound ostomy and continence in pediatrics. We hope that you will continue to inspire other nurses to specialize in pediatrics. We definitely need a next generation of nurses moving into this field. And I would like to now encourage anyone who has a comment or a question to put it in the question and answer box, and we'll make sure that it's communicated to Gail and Emily. Diane Krasner said, "Thank you, Gail and Emily, for such an inspiring story and your excellent insights and passion for pediatric wound, ostomy, and continence nursing." Thank you, Diane. And Paula Morrison says, "Thank you for having us." So that's good. Loretta Pike says, "Two amazing women that I've had the pleasure to work with and learn from." So a great comment. Great job from Caroline from Regina. And thank you, ladies. We appreciate you both, from Nancy Myatt. Yeah. And so if there are no other questions or comments, I would like to thank both Gail and Emily for participating in the interview for the WOC Stars Legacy Series. And we will be having an educational webinar tomorrow evening with Erin Rahathi on debunking myths around wound cleansing. And we'll have an interview Thursday evening with Catherine Kozel, Diane Gard, and Shirley McSavany, who will be talking about a historical ostomy exhibit and lessons learned from a lifelong career in wound ostomy and continence. And so thank you very much. And thank you to everyone who participated. And my final statement from this evening is, remember that children learn what they live. Thank you very much.
Thank you, Cathy.